Hi everyone. Although a lot of menopausal women experience mood swings, anxiety, insomnia, usually related to night sweats and hot flushes, and depression during the menopausal years, it is important to note that there are actually not much psychological or psychiatric disorders that have been directly related to menopause. In fact, many of these symptoms actually occur during the whole duration of a woman's life. In our culture, most of the responses or emotional responses of women are actually blamed on hormones. It's either the time of the month or it's the time of the life, which is menopause. Hormonal fluctuations can actually make us really go crazy in a way, making us feel like we're losing control, we're anxious, and we're kind of scared of what's happening. Women need to know that they're not going crazy. It's just very important to remember that although these symptoms are very distressing, it does not last long term. As soon as our body adjusts to the lower level of estrogen, everything will actually calm down. Shifting of moods and feeling of depression may be a result of social and environmental factors in combination with hormonal changes during the menopause. Prescribing tranquilizers and antidepressants for those women or menopausal women with anxiety and depression have been a very common practice for many years now. But it must be noted that this kind of practice does not actually solve the root of the problem. In fact, this kind of practice actually introduces addictive substances with very unpleasant side effects to a body which is already in a state of imbalance, and so causing more problems physiologically, psychologically, and physically. Depression, anxiety, and irritability may also be physically rooted. And what do I mean by this? Fluctuations of your progesterone and estrogen will actually cause emotional problems for a lot of women. Depression and mood swings that women experience actually may be related to the imbalance between the progesterone and the estrogen. The falling levels of estrogen actually affect the metabolism of two very important minerals, namely calcium and magnesium. These two are very important to maintain the good health of the nervous system as well as the bone and the heart. Therefore, what can we conclude from that? Maintaining actually a 1:1 balance between magnesium and calcium is very vital in actually assuring good health of the nervous system as well as our bones and our heart. A lot of the menopausal women are actually taking a high dose of calcium because of the bone requirement without much regard to the magnesium supplements. Now, if you take a very high level of calcium supplement without actually an accompanying magnesium, then this actually increases the need for magnesium more by the body. And magnesium deficiency is actually manifested as nervousness, anxiety, and depression. A good nutrition combined with taking calcium, magnesium, B complex, and amino acids can actually decrease the chances of developing depression and anxiety and increase our sense of well-being. You can also take chamomile tea, which actually has a calming effect and it induces sleep. Now, with more time in your hands, you can actually now schedule exercise routines that you can actually do or you can actually perform at least 3 times a week, coupled with relaxation exercise techniques incorporated in the exercise can actually help also increase the feeling of well-being. Now, if needed, you can also go for counseling. And finally, avoiding or removing vitamin robbers, namely caffeine, alcohol, sugar, soda, and certain medications like antacids, antibiotics, and diuretics can also help actually maintain a very good balance between the calcium and magnesium and the B vitamins in your body, thus creating a feeling of well-being. Let me recap. As I've said, Depression, anxiety, irritability, and nervousness may be a normal part of the menopausal changes that every woman will go through. Um, if for those women who don't want to be dependent on medications, you can actually go for the nutritional approach. And how do we do this? We do this by making sure that you have a very nutritious meal every time. So you have a well balanced meal of your proteins, your carbohydrates, your sources of fats, and the like. And you have to have always your fruits in your diet also. And vitamins are very, very important. As I've said earlier, usually the manifestations of depression, anxiety, nervousness, and irritability during menopause can be related to a decreasing level of estrogen, which actually affects the metabolism of both your calcium and your magnesium. So intake of these two vitamins is very important at a 1:1 ratio, because any deficiency in any of the vitamins may lead to all these emotional problems that we are repeatedly mentioning. So what else you add aside from your calcium and magnesium? You also add your B vitamins and your amino acids, and this can actually help improve or help decrease the chances of developing again nervousness, irritability, anxiety, depression. It can actually improve your sense of well-being. So hopefully that video was very helpful, and I'll talk to you soon. Thanks for watching. Bye bye.